On today's episode, we discuss when air hits your brain. We are joined by Mr. Andrew F. Alalade, who is a consultant neurosurgeon in the UK. He shares with us his journey to becoming a neurosurgeon, as well as sharing tips with doctors and young doctors to be who desire a career in neurosurgery. He trained at the University College London and has also served developing core competencies for the Academy of Medical Royal College's curriculum and training programs. Andrew is also a fellow of the Royal College of Surgery, Neurosurgery, as also a fellow of the European Board of Neurosurgical Surgery. He mentors young doctors and medical students in and around the UK and was also a council member of the Association of Surgeons in Training and an executive member of the British Neurosurgical Trainee Association. Please enjoy the episode. So welcome, Andrew, to A Slice of Health, and thank you so much for coming on the podcast today.
No problem. Thanks, Tammy. Thanks for the opportunity as well.
Thank you. So today we're talking about, the topic is when the air hits your brain, talking about neurosurgery, your journey into being a neurosurgeon, and also being a Black man in healthcare. And, you know, we're sort of at a critical juncture in history at this moment with, you know, the death of George Floyd and the protests that have been going on around the world. And I think it might be great for our listeners just to know if you as a Black man in healthcare have encountered any racial bias, or if you feel that there's any racial bias institutionalized in healthcare in the UK.
Yeah, it's a great thing you mentioned this today, you know, during this interview, because I was just having a chat with my kids earlier on. I've got two kids, 11 and 7, and they had a chat about this in school today. So this was all we spent the last hour or so talking about.
Wow.
And it's just difficult trying to have a conversation like this with kids. Coming back to my experience, I can remember a few experiences in training. Luckily, I've worked in places where I've been supported. I've worked with great colleagues. But yeah, I can remember 1-2 patients. As an SHO in neurosurgery, I can remember a patient who swore at me and did say, "Oh, you know, go back to your country, blah blah blah," and it was a tough one because I just kind of excused myself from the room and told the nurses that, oh, you know, it'll be better to get someone else to help manage the patients, you know, that I could get someone else rather than be involved because it would just be difficult for me. And then there was another instance where a patient had said they didn't want to see me in clinic where I was supposed to see the patient, but then they pulled their notes off and said they would rather see someone else. And my senior colleagues were quite supportive. They did say, "Oh, you know, try to act professional." It was a tough one to swallow at the time, but luckily since then I've not had any more unpleasant episodes like that. And you know, and even if you feel that you know, someone distrusts you or someone's not opening up to you as much as they would rather do to another doctor, you just take it on the chin and act professional. As the years went by, as a microaggressions, as a just underplayed emotions, it's difficult to say, but I can remember a few instances where as a senior registrar in London, we're talking to like a patient, and for some reason they would maybe look at the A&E registrar or someone else of a different color because they kind of expect the person to be the one who's going to be operating on them rather than you. You know, such you know, the little things like that you get to pick up. But you just get used to it and you move on, and it's all about, you know, giving a good account of yourself and doing your job really well. It's taught me to leave no stones unturned and to do a really good job, because at the end of the day, it's really your job that will vindicate you. That's like the way I look at it. So you put in a bit more effort into how you're relaying the scans, how you're, your surgeries, your documentation, you make sure everything is done right, because you do not want anything to come back and haunt you later. But overall, it's my career hasn't really been bad. I was mentioning earlier in the first recording, the one that we had to go off, that when I when I got my exams, my fellowship exams, there was a neurosurgeon who contacted me out of the blues. And he's a Black British neurosurgeon like myself. I kept track of the neurosurgeons over the years, and I knew that there were very few that were Black in the UK. Because sometimes there were times maybe I felt I needed to reach out to someone who had walked the same path as myself.
Yeah.
And I knew there weren't many like me. I'd done a kind of mental count at the time, and I thought there were about 5, 6. So I'd reached out to this guy. We hadn't really communicated much. But when I got my exams, he sent me an email and he said, "Oh, congratulations on your FRCS exams. I'm so happy for you. But I'm currently going through a court case at the moment, some medical legal stuff. And this is what happened to me. So make sure you get a job with nice colleagues, people who will be able to help you if there's any problems. Try not to fall out with anybody. And if there are any problems, make sure you report to the GMC as soon as possible." Which kind of got me a bit worked up. There's a bit of trepidation with that. And I kept asking myself for weeks after that, why did he get into trouble like that? Was it because he was Black? What was he trying to tell me? We never really had an elaborate chat afterwards, but those little things, they kind of leave small marks, small scars, things that you have to think over, years after.
Yeah, definitely. And, I can completely relate with what you're saying in terms of the GMC, because it's sort of, especially as a Black doctor, there's so many cautionary tales of, people that look like us being used as scapegoats, or people who look like us being, marginalized and being more likely to be investigated by the GMC, or more likely to be reported to the GMC by colleagues and employers as well. Was that gentleman, is he still practicing surgery now? Has he gone back to his career?
No, I think he's left now. I think he's left. Life of me, I don't know where he is at the moment, but I know he's not practicing in the UK at the moment, because I did try to look for him afterwards, and I haven't heard from him since.
Wow. Gosh. Okay, but we'll move on from that quite somber note, and just talk about your own journey into neurosurgery. When did you decide that you wanted to do neurosurgery? Had it always been an interest of yours?
Yeah, always. So I tell people this because this comes up very, very often. For me, it started when I was a teenager. So more specifically, when I was about 13 years old. High school, science class. Science teacher was talking about the brain, about the spine. It just seemed all fascinating to me. I just loved the whole topic, the subject, the fact that the brain and spine was just one massive network of neurons that coordinated and controlled everything. At the time, there were a few popular neurosurgeons. Most notable was Ben Carson. Everybody knew about him at the time. I'd read his book.
Yeah.
I'd come across his book. I'd read it. I even had a picture of him on my wall, as with some other medical, experts at the time. So that was it. I decided I wanted to be a neurosurgeon. I could remember my yearbook at the end of the school year. That was my final year in high school. I'd also written, oh, I want to be a neurosurgeon. I didn't even know what it was all about. But um, years later, when I met up with some high school colleagues and they brought the yearbooks out and they showed me, it was just quite exciting to see that. Yeah, I kind of predicted it at the time. Um, However, when I was in med school in uni in my second year, my dad got diagnosed with a brain tumor.
Oh, wow.
So he had traveled, or he was staying away from the family at the time because he was working in another region of the country, and we just got a call someday that he collapsed and was mumbling just gibberish. Just he was confused. He didn't know where he was. So he was taken to the hospital. He had a scan. It showed it was a brain tumor. Luckily for us, I didn't know at the time, but luckily it was a benign brain tumor. He had to go for surgery. We were so scared. For about 3 weeks before the surgery, every day was just packed with anxiety, packed with fear, packed with uncertainty. We just didn't know what was going to happen. So he had a surgery, and I can remember contacting the neurosurgeon and emailing him and saying, "Oh, do you have any tips or any advice on how to be a neurosurgeon?" Uh,
Really?
and I kept that email. I've still got the email today. So my dad had his surgery. He was fine. He came back home. He's done well. He's had follow up for several years. And down the line, I went along with my dad to one of his clinic consultations. This is now about 10, 15 years after, and had a face-to-face catch-up with the consultant neurosurgeon who operated on him at the time.
Yeah.
And that was a really good meeting because he was so excited to see me. He took me around the hospital, introduced me to the radiographers, to his other colleagues, to the receptionist, and we're like, this was the young dude who emailed me when his dad was here, years ago. And now at the time I was a neurosurgery registrar.
Yeah.
So he was so excited, introducing this neurosurgery registrar who had kind of achieved his childhood dream, or was on his way to achieving his childhood dream. Yeah.
Yeah.
So it's quite I feel quite happy when I think back at that particular day. Yeah.
That is really interesting, and the way things sort of worked out in terms of your dad's diagnosis, but then also you then finding somebody that you could actually ask for advice from, and somebody that was actually open in responding to you as well, because I can imagine a lot of people would not want to reach out to ask for that kind of advice, because they feel that they might not get that kind of response. So what would you say to somebody that in a young position who has read Ben Carson's books, Gifted Hands and all the lot, and wants to do that in terms of their career in medicine, but they're afraid that they might not get a response back? What kind of advice would you give them?
I think you've just got to reach out.
Yeah,
That's you've just got to reach out. Nowadays it's even so easy.
yeah,
And oftentimes I look at my Facebook, my LinkedIn, my everything, Twitter, and you get messages from junior colleagues, people who want you to mentor them.
yeah,
And I find it difficult to say no. And
yeah,
the reason why I find it difficult to say no is because I was like that years ago, you know.
yeah,
I was that young, starry-eyed little kid, just with ambition, with dreams, and I reached out. It was one of the first emails I sent. It was my Yahoo email, which I don't really use anymore. But I've still got the email, and even when I came back to the UK and I was looking for my first job, I just Googled as many neurosurgeons as I could find and just emailed them and asked for help in terms of what jobs should I apply for. I didn't get a lot of responses at the time, but I reached out, and it's such similar episodes have happened even later on in my career, where sometimes I've needed some advice or needed suggestions on what to do next or what should I do. And sometimes I just reach out to people. You are not sure of the reaction you're going to get, but, would you now say you're not going to do it? Because you're definitely sure of the outcome if you do not reach out to anybody, which is a 0% success rate.
Yes.
That's the minimum. That's the worst it can be. So if you reach out, who knows? 2 people, 3 people. If you reach out to 100, who knows how many people will reach out? So at least you've got to take the bull by the horns and go out and speak to someone.
Yeah.
And thankfully, humanity is not that bad. There's some good people out there. There might just be someone who has had a happy day and your name pops up in his mailbox and he or she decides to reply.
Yeah, that is really interesting, and I think that is something that people really ought to remember as well, that if you don't try, then that's the only time that you're guaranteed a 100% failure rate. But if you do try and cast sort of your seed amongst many waters, one might be able to get back to you. And so just tell us a bit about your journey then. So in terms of going to medical school, so where did you go to medical school?
Yeah, so I went to medical school in Nigeria. I was born in Wales, actually. So I was born in South Wales.
Okay.
Spent my first couple of years, Cardiff, Newport, lived for a while in Plymouth and Plimpton, and London. And then my dad was like, yep, we're going back to Nigeria. Let's go. We're moving back. So we went back to Nigeria. Southwestern part of Nigeria, to be precise. Finished up the rest of my primary school, went to high school there, went to a military school, which was a military school kind of linked with the Nigerian army. So you graduated from that and you automatically went into the Nigerian army. That's how it was. But then I signed out of it because I wanted to do medicine. I'd always wanted to do medicine. So I didn't want to continue with the kind of military career pathway. So I was one of 9 people out of about 172 military graduates at the time, and went and wrote the university exams and got into medical school. Initially, my plan was actually to go to the States, but by the time I got in, I don't think the what they call it, the admission fees were just pretty much sky high, and my parents were like, nope, you're just gonna continue with medical school here, university education here. So I did that, going to medicine, finished up, did a year as a house officer, and then came to the UK, continued foundation training, did a couple of SHO jobs in Glasgow, west of Scotland, and then in Leeds. And then 2009, I applied to neurosurgical training. There's a bit of a funny story, that one, because the first time when the applications came out, they said ST3 and there were 4 applications in the country. And I was like, there's no way I'm going to get one of those. Come on, 4. But I had a senior colleague who's she was a year ahead of me. She's a consultant up in Liverpool now, and she was like, "No, come on! I've seen you answer questions. I've seen you do stuff. I'm sure you'll be able to nail it. Just give it a shot." But I tell you, I sent in my application half-heartedly, and my thinking then was, you know what? Even if you do not get in, you've still got a year to plan and prepare again. So I was really thinking that I would just apply again next year, hopefully brush up my CV a bit more, and then get in the next year. But then a few weeks later, I got an email saying you'd been shortlisted.
Wow.
Now there's one part I missed out. 2 days before. No, yeah, that was it. So 2 days before the interview, we got notified that the numbers had increased from 4 to 9. So I started feeling a bit hopeful.
Yeah.
I was like, okay, so they're not just 4 jobs at ST3 level, they're 9 jobs. Okay. Maybe the big man up there is beginning to smile on Andy. So went for the interview, and it was a really good interview. It was really good. Like every station was so good. And this is now how many years later? This is about 10 years, or just over 10 years later. I honestly do not think I've had an interview as good as that one ever. And I've had so many interviews since then. But that just stood out. It was really good. So yeah. So I got an email later that I got shortlisted, I'd got a training number in neurosurgery, and I was going to be starting in London. Exciting times. So I can remember calling I don't know where the email came from. I've still got the email as well, but I can remember calling the number at the bottom of it. And I kept saying, "Are you sure? Are you sure you got this right? Are you really
Wow.
sure?" And the man on the other end of the phone was I'm sure he was just like, "Who's this? Who's this crazy guy?" Because I just kept asking, "Are you sure? Are you really sure about this? Are you sure? Are you sure you sent Andrew Alalade? Is this really for me?" I kept saying it over and over. And yeah, so came down to London. London was divided into two. So there's the North Thames, there was the South Thames. I chose the North Thames, did my rotations. So worked at the Royal London. I worked at Queen's Hospital in Romford. I worked at Great Ormond Street. I worked at Queen Square. Final year was chief registrar in Queen Square. Wanted to do skull base. So started to do the skull base rotations. Yeah, and then I did my exams, ST7 passed, and then started thinking of how would I get a consultant job. Decided to do a couple of fellowships. So I'd targeted the subspecialty areas I really wanted to improve my skills on, and I felt this were the areas I loved in neurosurgery. So I got an opportunity to do a traveling fellowship with an American neurosurgeon in New York who's known for some anterior skull-based work and does a lot of minimally invasive procedures. And it goes to what you were saying earlier about, do you reach out to people? And I'd heard him present some years before that. And I just went up to him, introduced myself, told him I'd monitored some of the projects over the years, things he had done, things he had worked on, some of his work. And he gave me an opportunity to come and work with him. So I kept that, and I kept in touch with him for about 3 years. So by the time I finished my training, I just told him, "Oh, now I've got an opportunity to come and work with you. I would want to come and do a fellowship with you for 6 months." So I went there, did a fellowship with him for 6 months, and then went to Australia for a year. So I did a skull-based fellowship in Australia. That was in Brisbane, which was really good, nice weather. The only drawback was that I didn't go with my family for, certain reasons, work-related reasons on my wife's side and because of the kids' school. So that was me out in Brisbane for a whole year, and did quite a bit of vascular as well. So that was good. Stretched my skills and expertise a little bit. And then I had to come back to the UK. And it was tough because with neurosurgery, there was now circulating stories that, there were no jobs in the UK, no jobs. It was tough. So I came back and I did a fellowship in Liverpool for a year before I now finally got appointed at Preston in the Northwest. And that's pretty much been the story of my life. Yeah, neurosurgery wise.
That is that is quite interesting, and I think that really goes to show in terms of getting experiences and exposures, like you said, in terms of reaching out to someone and saying, can I come work with you and, or shadow you, observe you. And I think maybe sometimes as well, the reason sometimes don't get those opportunities might be because sometimes they don't try to seek them out, or maybe they don't, put themselves in a position to be rejected, but actually sometimes you're actually putting yourself in a position to get sort of a stepping stone going forward. And what kind of encouragement would you give to young people who, because I know, there's so many Black children who have read Ben Carson's books. I read all of them when I was a teenager because, there are only so many jobs that you can do in going in a black household.
Absolutely.
About 20 years ago, there were only a few things that you could do. And so Ben Carson, was one of the things that, a lot of our parents encouraged us to read. And so many of us were encouraged to pursue medicine, and some to then pursue neurosurgery as well. But it's not to say that it's not without its obstacles. And so many of us have faced, different obstacles along the way. And that might be because of race, gender, social economic status, or just lack of opportunity in the environment that you're in. So what would you say to, let's say, maybe a 16-year-old who is, well, they're not doing GCSEs this year because of coronavirus, but maybe, a 15-year-old that might be doing their GCSEs next year and thinking about, well, maybe trying to apply to medical school, and thinking about neurosurgery, what kind of advice would you give them?
Yeah, my advice might not necessarily, it's going to be twofold. It might not necessarily be the most popular one. So a couple of years ago, there's this list of 11 things that went viral some years ago. And it was like the 11 rules of Bill Gates, something like that. 11 rules of Bill Gates. And the first one was, life is unfair, get used to it. And the first time I saw that, it really annoyed me. I was like, why would you say life is unfair? Get used to it. But then I went over that statement again and again. And my new interpretation of it was like, in life, there will be disappointments. Nobody is really going to have a challenge-free life. But you have to make sure that those challenges do not overcome you. So they could help in defining you, they could help in refining you, but they shouldn't overcome you. So you see those challenges and you shouldn't just give up and say, you know what, or I can't see any Black neurosurgeon in the UK, so it means I'm not going to be a neurosurgeon. No, it just means that take a few steps back, have a strategy, have a contingency plan. There are going to be several ways of achieving this. And it's not just by exercising your IQ. Sometimes you've got to exercise your EQ, your SQ as well, your emotional quotient, your social quotient. You've got to reach out to people. That's one thing that we've said kind of repeatedly today. So the different ways in pursuing a goal.
Yeah.
And it's not just you see something challenging and you're like, no. And now I was talking with my wife the other day and I said, there was one time in my career, there was one time where I nearly gave up. And I still remember it very clearly. And that was in 2008. I was an SHO. I hadn't got a number then, but we had just had my first child, my daughter. And I started getting scared because I was like, are you going to make neurosurgery the one and only thing and not think about your family? Because you need to think about your family. Now you've become a dad. And that scared me a little bit. And I stay having second thoughts about it all. I was thinking, should I apply to something else? Should I change my mind? But I just knew that if I changed my mind 5-10 years down the line, I wouldn't be a happy man. And I just kept going. But I still remember then that, things nearly changed at that moment because I was scared of how I would cope. My family have been really helpful. I've got a good support network. My family, my siblings, my wife, my kids. And sometimes when you feel the lowliest of the low, they're just there to help. So it's always good having a good support network. People who would speak some sense into your head when you want to give up.
I love
Pretty
that
much.
in terms of that's really great, and I'm so glad that you touched on having moments where you want to give up, because that is reality. That is what life actually is. You're pursuing a dream and then there's a stumbling block and you're like, okay, is this where I call it quits or do I keep going? And having people around you who believe in your dream as well, because sometimes the people that are around you might not believe in your dream and they might just be like, who does he think he is, or who does she think she is, in terms of trying to reach this goal. But having people around you that really encourage you is so important. And in terms of neurosurgery, as a career in itself and as a specialty in itself in medicine, what unique things do you think neurosurgery has as opposed to sort of other, maybe specifically also other surgical specialties, that makes it so different and so unique?
Yeah, so dexterity, all those hand-eye coordination, we all know that. That's for all surgical specialties pretty much. To to a certain degree, maybe more when you're operating on someone's brain and you know that any small misstep could cause sinister consequences.
Yeah.
That's one. So it's a different type of pressure.
Yeah.
And one thing I've been grateful for belatedly is the fact that, like I told you earlier, my dad had a brain tumor. So that allows me to put myself in the same situation the patient and his family members or and her family members will be in as well. And
Yeah.
sometimes I do mention it to them that, listen, I've been there.
Yeah.
Um, and I understand how you feel because, or at least I can try and understand, maybe not understand totally because um my dad's brain tumor was a benign one. So
Yeah.
we were lucky in that regard. But sometimes that's what patients and their family members want to hear. They just want to hear from someone who's empathetic, someone who is willing to come down to their level.
Yeah.
Um, what else about neurosurgery is different? Communication is a big thing in neurosurgery, whether with your theater staff, whether with your junior colleagues, whether with the patient. Communication. There's a lot hanging on to every word. Just the wrong word, just the wrong word verbally, or a wrong word in a letter could lead to different interpretations. So you've got to be very, very careful. Um, that's another thing. And then the third thing I would just want to say is when you do, for some reason, a lot of people are so scared about the brain, understandably so. And even other medical specialties, people who are not neurosurgeons or who are not neurologists, once it's something to do with the brain, everybody gets really scared because the brain is maybe apart from the heart, it's the one organ in the body you tend to be very, very scared of. So when there's something wrong with the brain, everybody kind of loses it. And you've got to always remember that you just need to. And it was something I learned in my early years as a junior registrar when I started being on call and holding the blip is it's like the way a lawyer is supposed to be able to argue his or her case quite quickly,
Yeah.
eloquently, and effectively. That's kind of the same way for a neurosurgeon, where you have to make life or death decisions sometimes,
Yeah.
and really quickly as well. You've got to think quickly, you've got to implement plans on time and efficiently to get a good result.
Yeah.
So it did take me some time to kind of get on top of that as a junior registrar, but over the years, I have noticed, that my decision making has just improved significantly, and you know it as well when you get good feedback, when the patients come back to thank you, when your other colleagues um, thank you and acknowledge the role you played in the management of their patients. That makes you happy. When you have a patient who was collapsed, who was unconscious, or who's blind and starts to see again, or was unconscious with a stroke and starts to walk again, the joy is just immense. And I don't think there are many things in the world that are comparable to such.
Yeah, that is amazing. I'm so glad that you talked about in terms of, well, one, also getting the feedback and also getting the courage and confidence, because, it's sort of baby steps initially. You fall down a couple of times and then you keep going. And then also seeing people walking on the ward. So I did a neurosurgery SSC in med school, and then I also did a neurosurgery post in foundation years, which was absolutely amazing. But then there's also quite a lot of mortality and morbidity in neurosurgery, in terms of, obviously, when you, like you said earlier, when you're going into someone's brain, sometimes you don't know what is going to happen on the other side of, opening the brain. And that's where the topic for today's podcast comes
It's
from.
the brain.
Yeah, that you're not the same once the air hits your brain. How?
Have you read that book?
Yes, yeah.
Okay, yeah. I did think so. I did think, oh, she must have read this book.
Yeah,
That's how she read this.
definitely. Yeah, I absolutely loved neurosurgery. That's why I did it in F2. I think another one of the books that I absolutely loved that I read in med school was The Man Who Mistook His Wife for a Hat.
Okay. I've not read that one.
Yeah,
But I've definitely read Where Air Hits the Brain, and I can still remember reading it on a bus from Essex into London and just smiling and chuckling all the way through, because I found it really amusing. It was a good book.
Yeah, and so that's really my question. How do you deal with the morbidity associated with neurosurgery?
So things have really improved now in neurosurgery.
Yeah.
A lot. So from the years where, and I'm in, I do skull-based and vascular, which are two subspecialties within neurosurgery that were known to be associated with quite significantly high mortality and morbidities, let's say 90 years ago, maybe even up to 50 years ago. But now with microsurgery, with microscopes, with better equipment, lots of trials, there's a lot of evidence-based medicine now. Things have improved a lot. So sometimes, you operate on a brain tumor patient and you tell them, oh, you'll be home within 2-3 days. Some people find it difficult to believe, but it's true, because now it happens. And it's not just based on the neurosurgeon's expertise, it's based on the multidisciplinary team approach. So a good preoperative workup, anesthetic team, good nurses, good registrars, good physiotherapists after surgery, the better medications now, better equipment. Not everything has to be dealt with by opening the head anymore. So there's a lot of radio surgery now. There's a lot of endovascular interventional treatments. So things have really improved now. There's still some things that are, like you said, associated with that prognosis or that outcomes. And some of these things is regardless of whether you have neurosurgical treatment. A lot of things that cannot really be treated by neurosurgery, or maybe with neurosurgery would not have good results. It means that most probably, even without neurosurgery, the results were going to be dire anyway. So let's say someone very elderly has a very big brain bleed, it means that whether you operate or you don't, the chances are pretty much the same. So there's some things like that where neurosurgery is still not, it's not the do or be all. There's still some things that you can't really fix depending on how significant they are. But overall, there was a presentation I did a few months ago, and I was looking at some complex brain tumors that were done like in the early 20th century, and the mortality rates was so high. But now you compare them to what we have today, when most patients will come in and will go home pretty much days after. So it's much reassuring now. I think it might have been, my perspective on these things would have been way different if maybe I practiced in those times when things were really, not as optimal as they are now. But it's so different now because 9 out of 10 times you would be doing a good job and getting good results.
Yeah, that is awesome. I actually really love that in terms of sort of seeing the evolution in medical practice and where we've gotten to from the past. And obviously, when it comes to the brain, there are a few things that I just wanted to talk about in terms of people's health anxieties and their worries about their brains. What advice would you give to people who have a headache and think it's a brain tumor?
Then you've got to speak to the right person. Informed knowledge is the best
I
thing.
love that. Informed knowledge. Yeah, that is not.
Yeah, because not especially now where there's so much,
Yeah.
everywhere you turn, there's a phone and you've got internet access. There's a computer, you could Google. Some people even say a lot of people are cyberphonic, where there's so much. You just check for unwarranted information on the internet, and all that's not so helpful. So it's all about getting the right people to speak to. And sometimes, like I tell my patients, I'm like, we're doctors, we're experts, but many times we might not know your body as much as you do. So it's okay to be worried. It's okay to want to look up stuff. But the key difference, the key thing is to speak to the right people, to speak to the right experts. So speak to your GP, let them know. Speak to a health professional, let them know. And then they can differentiate. A lot of headaches do not need to be worried about. The classification for headaches, there's so many types. The main headaches that are worrying to the neurosurgeon are the ones associated with brain bleeds, which are probably like the worst headache one has ever had in their lives, where you feel like you've been hit from the back of the head. It's really terrible. You feel like you've been hit with a bat. And then the other long-standing, prolonged headaches that will go on for months and months or even years. If a tumor is not associated with raised pressure in the head, in the skull, or if it's not associated with a bleed, or if it's not associated with a tumor, it could be associated with other things. And those are the very common ones that we see, stress, different things going on around, sometimes even seasonal changes, allergic reactions, sometimes even the menstrual period, depending on what time of the month. There are many other things that can cause headaches, that can trigger headaches. So it's what looking into what causes your headaches and speaking with your GP, and get reassured once you've had the necessary medical chats or investigation, instead of getting yourself worked up. Because even getting worked up can make you have more headaches.
Yeah, definitely. And I think I'm just going to go back to what you said about, informed knowledge is so crucial in terms of where we're at now, because everybody online is a health expert, everybody online is a health coach, everybody online sort of has their own sort of fads and fallacies about health, and that obviously then goes ahead to promote a lot of health anxieties, as well. And just as we're wrapping up now, what would you say to, so, with, and it's just going back also to sort of race in medicine as well. And I really like what you said about, the encouragement that you got in terms of making sure that you're staying professional in everything that you're doing. What would you say to people who are quite anxious about being Black in healthcare? The famous doctor, Mr. Selu, who went to prison for manslaughter and had the convictions expunged because he actually wasn't culpable, did a podcast recently, and I was listening to it, and he said that his son at the time of the trial was finishing his final MBBS exams in Manchester, and he passed his exams, and he said to him, he was like, what, Dad, that I've been thinking about this for a while, and with everything that's happened, with the way you've been treated, you did everything right in your power, and they still came at you. I'm not gonna practice medicine, and I'm not gonna take the F1 job that I've been offered. And up till now, he's still not practicing, even though Mr. Selu has gone back to clinical work. What advice would you give young Black doctors who are in that position, who feel that the medical legal stress and anxieties of medicine outweighs their initial desire that they had to help people? What would you say to them?
That is a multifaceted question you've asked, and I listened to that. I listened to that interview with David Selu, and you're right. I even got teary when he talked about his son's decision, because that did, it did strike a chord. Now, how do you deal with that? I think medicine now is so, medicine has evolved a lot, and there are many areas to it. Not every part of medicine is clinical, where you have to do clinical stuff. That's one way of looking at it, in terms of, if you want to be in the medical profession, it doesn't necessarily be that you will be in the front line, or you'll be the full fire, where the decision making, the really acute decision making, the serious decision making would be left to you. That's one way of looking at it. Another way of looking at it is saying that, speak to as many people as possible before you make a definite decision, because it could be that you get anxious about one particular thing, and then people reassure you and just give you more scenarios to think about, things where you get to be encouraged by the things you get to hear about in medicine, because medicine is not altogether bad. I know David Selu's experience is an experience that I would pray never to have, because it did look, I don't even know how he came out of that, with, and he's still firing on all cylinders, after being convicted, even, and accused of something that he did not really do. So it's a bit of a tough one to answer, because medicine is not like the other professions, where we're not doing it for the money. It's, you go into medicine purely because of it's the love for humanity that takes you into medicine. But then it doesn't mean that you should not be appreciated, you should not be acknowledged, you should not be remunerated enough. We're humans. Everybody wants that. Everybody wants to be appreciated. And it's just always good to know. And that's why when people come up to me, and I do encourage a lot of young people to try and talk to mentors, try and talk to senior colleagues, to know as much as possible about the subspecialties or specialties that they want to get involved in, because you can't know everything 100%, but at least a good amount of knowledge about something would help you to make critical decisions before you get into it. So if there are any anxieties, then the earlier you get to know about it, then you could make amendments or do some slight tweaks, to change it a little bit and say, okay, rather than surgery, maybe I'll do medicine. Rather than go clinical, maybe I'll go non-clinical and I'll do health management. Rather than medicine, maybe I'll just do obs and gynae, things like that. So it's good to get as much exposure to things before you get into it. I think that's I'll leave it at that.
That is awesome. Thank you so much. I agree with that in terms of, getting the understanding and knowing what it is you want. I definitely come across quite a few people who complain about the specialty that they're in, and feel that they're not in the right place or they're not enjoying what they're doing. And then I also meet some young, especially quite a few young doctors who they finished medicine and they didn't practice one day in clinical work at all. They went straight into research, or they went straight into teaching, lots of different things like that. And so definitely understand what you like, what you enjoy is so crucial in giving you the peace of mind that we all need to be able to live long, full and healthy lives. Thank you so much, Andrew, for coming on the episode. It's been an absolute pleasure talking to you.
Absolutely. And thank you again. Thanks a lot, Dami, for inviting me on your podcast.
Thank you so much.
Thank you for joining us on today's episode. Do share this podcast with 2 people who have not heard about us before. Remember that this podcast in no way replaces advice from your own doctor or physician. Do subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And do join the club at asliceofhealth.club and drop us some suggestions or questions that you might have. Don't forget to be a health champion wherever you go by separating health fact from health fiction.